Let's turn to Sean Sullivan. He's a congressional reporter for the Washington Post, and he joins us now. All right, Sean, so Senator McConnell has previously spoken out against repealing without a replacement, arguing that it could destabilize insurance markets. Explain the turnaround here, especially given that it's not as easy as it was back in 2015 when they kind of knew that President Obama was going to veto it.
Yeah, that's the really big difference here, right? When you look back in 2015 and when this thing had overwhelming Republican support, Republicans looked at it and said, well, look, this is never actually going to become law. Obama's going to veto this. We don't actually have to worry about the implications. Well, this time it's different, and I think a lot of moderate Republicans are going to come out today and say, we don't like this. We're not proceeding to this. So what McConnell is doing, and remember that McConnell is the ultimate tactician. He, looks at these things 2, 3, 4 moves ahead. He's essentially trying to show that, look, there aren't the votes here for pure repeal. You hear people like Rand Paul and even President Trump and Ted Cruz say, you know what, we got to move to pure repeal. Well, this is McConnell's way of showing not only Trump, Paul, and their allies, but really the entire country that there is no appetite for pure repeal at this point in time.
Still, what he's pushing for is to repeal immediately in terms of voting on a repeal immediately, and then it would sort of take 2 years before it was actually implemented. And presumably, in those 2 years, Republicans would be working on some sort of a replacement, and they would kind of bypass the midterm election time when, things could get a little dicey for them because they haven't done much so far. Is there an appetite for that, this idea of repealing immediately and then dragging out the replacement process?
There's not a big appetite for that in the Republican Party. I mean, in one sense, they would be setting a deadline for themselves to, as you said, come up with some sort of solution, say, look, let's take care of repeal now. And we've given ourselves essentially 24 months to come up with a replacement. But they've spent the better part of, the first half of this year trying to come up with a plan, and they haven't been able to agree on anything. So I think if you're a moderate Republican, if you're facing re-election in 2018 or even 2020, you look at this and you say, well, hold on a second. What are the odds that we'll actually come up with a replacement? We might not ever do that. And then what we'll be left with is a system where we don't have Obamacare and we don't have anything in place to replace that. And I think a lot of Republicans are fearful that that would lead to catastrophic coverage losses around the country and that they would be the ones blamed for it. So I don't think we're going to see a lot of support for this. And I think Mitch McConnell knows that.
All right, so, Sean, the Congressional Budget Office estimated that by simply repealing Obamacare, 18 million Americans would lose their health care in 1 year alone. What are the implications of that happening on President Trump's watch?
Yeah, those implications would be huge. I mean, if you look at the Senate bill that is essentially dead now, that was projected by the CBO to have led to 22 million people losing their coverage over the course of 10 years. And as you said, we're talking about 18 million in 1 year. So 22 million over 10 years worried Republicans enough already. Just imagine, what level of worry they're going to have if they have to deal with 18 million people losing their coverage in 1 year. That would be, a political catastrophe for Trump. It would be a political catastrophe for the Republicans. And I think it's another reason why this is a non-starter. This really has been a non-starter, even though we've seen Trump talk about it, we've seen Ted Cruz talk about it, and we've seen some of the other conservatives talk about it.
So some Republicans, including the president, have suggested that Democrats should now maybe get involved in the health care reform process. Maybe the two sides can work together. The Democrats have basically been sort of standing on the sidelines watching this whole thing unfold. What are you watching for on that front in terms of the two sides working together?
Yeah, when I talk to Democrats and Republicans, the takeaway that I get here on the Hill is that the odds of any kind of deal happening are almost zero. You see on the Democratic side right now a lot of pressure from the Democratic base to push for a single-payer system, to push for something that goes even further than Obamacare. And then on the right, of course, you have Republicans who want to repeal Obamacare. So given those two things, it's almost impossible to see McConnell and Chuck Schumer, Paul Ryan and Nancy Pelosi coming to the table somewhere and saying, okay, here's a deal we can both get behind. The reality is these parties are so far apart on healthcare policy right now. They are so far apart on the politics of healthcare. It's, as I said, very, very difficult to see anything, even a marginal deal coming together with Republicans and Democrats. I just don't see it happening.
Meanwhile, as the clock keeps ticking, more and more you find there are an increasing number of people who actually like the Affordable Care Act as they're sort of getting to work with it. There's still a lot of flaws. So
it proves that old adage, Sean, that in this country, historically, it's always very, very difficult to take away an entitlement that has become entrenched, even if A lot of people don't like it,
Yeah.
even if there are some who say it's perhaps bad
It's
for
flawed.
business. It's flawed, but it's just hard to take something away once you've given it to folks.
Yeah, that's a good point. And, you know, it's important to remember, too, that there were a lot of Republican governors who supported parts of the Affordable Care Act. I spent some time at a governor's conference over the weekend where Brian Sandoval in Nevada made the point that he was the first Republican governor to expand Medicaid under the ACA. We've seen other governors do that, John Kasich. So, you know, it's not just Democrats over the years who have owned Obamacare. Republicans have also taken ownership of this in a way. And you're right. Now that they have instituted these programs, these expansions, these initiatives, it's very difficult for them to go to their constituents and say, well, hold on a second, we're going to take this away. We're going to make these deep federal cuts in Medicaid spending. I think that's something that has worried a lot of Republicans. And from day one, I think a lot of them looked at it and said, look, there's just no way we can do this. This is not politically palatable. And that's why we've seen so many struggles, I think, over the last few months as these Republicans have tried to get this done and ultimately failed, as we've seen today.
Sean Sullivan, thanks a lot.
Thank you, guys.